So today I'm going to be introducing mental illness and substance abuse disorder, the correlation between the two and how they're viewed in society, both by regular normal day people as well as healthcare professionals. So to begin with the correlation between substance abuse disorder and mental illness, over 7.9 million adults in the United States suffer from one or the other, with the most common range being males 18 to 44. Actually, every mental health disorder listed by the American Psychiatric Association is able to also have an issue with substance abuse disorder. So it doesn't mean that having a mental issue negates having the ability to also have a substance abuse disorder. The most common illnesses related to having a substance abuse disorder include bipolar, schizophrenia, anxiety, OCD, PTSD, panic disorder, and antisocial personality disorder, with disorders that affect your mood being 4 times more likely to have a substance abuse disorder than those who do not suffer from mood disorder. This also is true for schizophrenics, who over half of them report having an issue with substance abuse, as well as almost 90% of them reporting being smoking marijuana, whether abusing it or not. So the cause and effect relationship between mental illness and substance abuse disorder is bidirectional, meaning that those having mental illness can cause having a substance abuse disorder, as well as having a substance abuse disorder can create the side effects kind of related to mental disorders. So the first way in which having mental disorder can kind of lead to a substance abuse disorder is this idea of self-medicating. This is very common with people who suffer from mood disorders, that things such as anxiety, depression, that create these kind of negative feelings. A lot of these people use these drugs to kind of create these positive feelings that they're unable to kind of feel with their normal mental disorders. This is also very common with people who suffer from schizophrenia, by attempting to kind of mitigate the side effects from their disorder, as well as the very strong side effects of their antipsychotic medications. So to go off of that into how having a substance abuse disorder can kind of lead to the effects or symptoms of mental illness. Commonly, with these two chemicals, serotonin and dopamine, drugs such as MDMA are a very common college drug and commonly abused by people. It affects your serotonin levels and the way your brain produces this chemical naturally. And once you're off these drugs, your brain isn't able to kind of create this chemical the same way, leading to disorders such as anxiety or depression that a person otherwise wouldn't have had they not abused these substances. Another very common chemical affected by this abuse of drugs is your dopamine levels. So a very common kind of drug, a stimulant or an upper kind of drug, affects these levels, and again, your brain isn't able to create them naturally as it would had you not used these substances, leading to symptoms like psychosis, anxiety, depression, sleep disorders, and extreme cases commonly with abuse of cocaine can lead to suicidal behaviors. So to go off of how these people are viewed in society, those with mental illness or substance abuse disorder, they're often stigmatized, with a lot of these people reporting that they hear them called names such as junkie, loser, crackhead, or kind of these negative terms that don't really understand why they are the way they are. This is also true for those with mental illness or substance abuse disorders experienced in healthcare fields that are outside of kind of their specialized in these two fields, so things like dentists and regular doctors and things. In this case, there was an interview done of those with mental illness or substance abuse disorders about their experiences in a dental office. A lot of them felt the doctors would blame them for their physical state, often due to the cause of these substances, leading them to feel embarrassed or ashamed and not really willing to come back. They also listed that a lot of these healthcare professionals would just avoid physical interaction, either not allowing them in their office or being less attentive to them in general. So to go off of how these things are approached in treatment facilities, so there was an idea that you would treat one before the other rather than treat both kind of in an integrated fashion. So it was believed that if a person had a substance abuse disorder and mental illness, that you had to treat the substance abuse disorder before the mental illness, when in reality they can both be the cause of the other. So it's kind of hard to defeat one for the other without approaching both. So to go off of this point, a lot of these healthcare workers in the fields are only specialized in either mental illness or drug or substance abuse, without really being able to scan and kind of treat both. This goes true for a lot of medications. A lot of them are prescribed to people with mental illness without kind of taking into account for how they have been abused substances in the past. Another point is a lot of these programs are intended to take care of short-term kind of issues and problems rather than approach the long-term solutions. So when people have suicidal tendencies or having manic or panic attacks, a lot of the times they'll keep them for a couple days to push them through this, but release them immediately due to hospital space and different things without approaching the real problem. So a way to kind of combat the stigma, both by regular everyday people as well as these people in the healthcare fields outside of mental illness and substance abuse, is education. So this includes education not only on what mental illness is and what substance abuse disorder is, but how these two are connected. This goes again true for not only regular day people, but also these healthcare professionals. So moving on to how we can improve treatment in these specialized facilities. There needs to be an approach to long-term care rather than short-term solutions, as I mentioned before. Medications need to be coordinated differently for people who also have mental illness and substance abuse, so that they aren't led to pills or different things that can be addictive. There needs to be training for these healthcare workers that can specialize in both mental illness and substance abuse disorders, that they can treat both without just reflecting on one. So some of the ways that people who have suffered from these illnesses and gone through treatment themselves have stated that they would like to see improvements include minimal but effective medications, as well as support groups or different things that can kind of help them through these intense side effects of often very strong drugs. They've also requested that there is a client-centered approach in these facilities rather than just social workers trying to get through the day or different things like that. They've asked for what they describe as a cozy atmosphere with possibilities of having a drop-in center where people can come visit so long as they're drug-free and just stay and hang out for a while. They've also requested that in these facilities there's more daytime activities to kind of eliminate the boredom that often leads to these substance abuse disorders. And they've also requested different things like legal help and help with social services, things that are, even for a normal person, very difficult to kind of communicate through. And the final point they made was that they would requested more benefits for good behavior rather than punishing them. An example they gave is the financial benefits, that as soon as they get back into the regular day world and get jobs and things, a lot of these financial benefits are taken away when they still need time to adjust and different things like that. So with making these adjustments and improvements, we can improve the stigma in society, both among healthcare workers and everyday people, and improve the lives of those who suffer with these illnesses.